iPhone Air. iPhone Air is so thin. It's absolutely thin.
सब बैटरी इशू होगा उसको।
Battery, तो they are telling that battery would be lasting for 2 days. Apple, in Apple Watch, I use Apple Watch, but my version is pretty old because don't feel like changing it too often. But I'll say, truly speaking, my Apple Watch is useless for the marathons because for full marathon, say when you are going for so much intensive, your battery drains out. For that, no one can beat the Garmin. Garmin, they are the timekeepers of the Olympics. So, wonderful watch. It lasts superbly well. Plus, it has got so many parameters. But this time in the Apple Watch, they have come up with one very interesting thing. And that is that depending upon, that is what is called as the heartbeat motivation. So as you run, right, depending upon your heartbeat, right, it will motivate you. Okay, come on, you are going good, this, that, everything. So that was one better thing. And second is also taking the blood pressure. So it will, in case if the blood pressure starts rising, so it will inform. And that was bit of the atrial fibrillation, right? Fibrillation, so even this watch also it takes the fibrillation in case if there is any any irregularity in the beat, so it informs. That was that they have improved it with a military sensor, but these were the two, three things. So many messages. Done. Couldn't send audio, but I'll show this done. अरे यार 15 लोगों ने भेजा है. And some of the emails, I mean, that's so beautiful. Did you actually like the design of new iPhone? Is not. अब पता नहीं विक्रांत, मतलब I not the original Apple design. Yeah. Do you play Forza? नहीं, नहीं. Day before yesterday I was traveling, so and अच्छा ठीक है. See, such wonderful emails they were receiving. In some of the cases, first shot, and you send the audio. And the best what I liked is 27 attempts. I mean, she 27 attempts. So that's why I said that was you are like Amitabh Bachchan. Means 7 movie बिल्कुल flop गई and still had the courage कि नहीं, we go for the 8th one, and he became a superstar. Right. So this was very, very sweet. बाकी तो yes, 5 attempts, 12 attempts, multiple attempts were there. But that's what it is. Chalo. So today's topic, it's time. Yeah, it's done. 2 minutes past 10. Let's start. Yes, Athar. What's it? In the logi steering. Ah. So today's topic is back. Now, if you have revised the video already in advance, that is good. If not, don't worry. And I received your mail also that can we go a bit slow? We are already going slow, but at any point, say, if you feel like that, no, anything is not clear, ask immediately and never be shy. Right? I will be taking your name, but never be shy. Right? In case if it is like you feel like you don't want to speak, just send a message. But never be shy and don't leave the lecture in between. Right? What you wrote it very honestly that you felt bad that you are not knowing the concepts and you left the lecture from that. Right? Never do that. I mean, that's what our teacher told. Be besharam in asking. Be absolutely besharam. So, कोई टेंशन. मतलब in offline lectures, when teacher used to ask, पता चला? And we say you like this. Immediately खड़ा करेंगे. हाँ के ना? And it is like they'll say कि अगर पता चला तो repeat. अगर नहीं पता चला तो तो बोलो क्या नहीं पता चला, right? It is like, this is so much better. You can always send a message. But otherwise, as such, I feel like always be bindas. Bol do. Chalo. So it is back. Right. Beautiful back from multiple factors. One, your looks, right? If you really focus on the back, right, it would matter a lot. It would matter a lot. Your entire structure. And second, that many times people sit with hump, right? चलते भी हैं तो ऐसे झुक के चलते हैं. These are the back muscles. If you work on them properly, right, your posture, your walking style, everything would change. Right? Even your running style, your capacity. As many times I say that when you are running with your upper body, and when you are doing the javelin throw, you are doing it with your lower body, right? Because in javelin throw, जो भाला फेंकते हैं, तो at that time the push which is to be given, so it comes from the lower body. And if the upper body is weak and you are running, though your legs are strong, right? But if the upper body is weak, so then your body would be swaying here and there, and you'll be wasting so much of energy that you won't be able to complete the marathon. So that's why we'll be taking this concept in the form of that when you do any of the exercise, right? So which muscles are you working on and how to modify your exercise to become more efficient. Right. So all right, it's time. Let's start. We'll be starting with same concept which are known to us. So here it is the skull. This is the complete back. You know the scapula very well. Just a minute, right? They have come. Be right back. 1 minute. Yes. So all set. So skull and the scapula, spine. So we know the scapula, we know the skull. Now on the skull, when you take your hand back, you'll be able to see absolutely one clear prominence, and that is the external occipital protuberance. Protuberance means something which is very prominent, right? Occipital, because we know this is the occipital bone, right? Obviously. And this is external. External means, I mean, inside, yes, there is internal occipital protuberance. So when you take the skull, right, this is like a plate, and that's the occipital bone. So there is one which is externally, and then there is one which is internal also. So when we'll be cutting the skull, right, and then we'll remove the brain and we'll see that, yes, it is that internal occipital protuberance that is also there. So this is a landmark which you can feel very easily. Above, now external nuchal lines, we won't be able to feel it that clearly, right? Because then it is covered by the muscles and everything. But when we'll take the skull, you'll be able to see it is in very clear line. So there is superior nuchal line, there is inferior nuchal line, intermediate, all those lines are there. But the most prominent part, which we must not miss, it is the occipital protuberance external. Hip bone, you know that. Moving further. Well, iliac crest, that is always we say that is when you stand right in style with the hands on your hips, so that your entire this line, that is the iliac crest. Hip bone, which is made up of ilium, ischium, and pubis. So these are the three bones which are combined. It is also called as the innominate bone. Hip bone, right? It is a very routine name. Actually, it is also called as the innominate bone. Innominate means who has got no name. That is the actual meaning of it. Because the bone shape is so ajeeb. So that's why they said, kiska kya naam dena? Kuch nahi, to iska naam benam. Right? So that's why this is like an innominate bone. Then the sacrum and the coccyx. Coccyx also called as the tailbone. Right? Tailbone. And the sacrum. Posterior portion. Yes, this is posterior. Now, when we are standing, the tip of the finger that lands on the anterior superior iliac spine, right? We'll just see it over here. Here. Right now, this is anterior, right? This is anterior view. And we are watching the tip which is over here, this tip, right? It is called as the anterior superior iliac spine. So the exactly the same way there is posterior superior. Here it is. Posterior superior iliac spine. So the entire iliac crest, anterior and the posterior, right? These are the two prominences.
Sir,
Huh?
there is inferior one too, right?
Inferior also. Yes, that is inferior also. Acha, the dog is steering behind you. Yes, I got that steering wheel. I got the cockpit also. I'll show you. It is there only. It is iliac spine. So we start with the muscles. We start with those muscles which are again known to us. No doubt about it. We know the trapezius. You know? So we keep on marking. We know the trapezius. Yes. We know the deltoid. Spine of scapula, though we have discussed so many times. So that is true. Then that spine, one which is behind or below it, it is infraspinatus. Supraspinatus is covered by the trapezius, so we are not watching it. Then just underneath the infraspinatus, there is teres major, right? Teres major because it is a big muscle. The teres minor is above, right? So right now we won't be able to see it, but we'll see it very soon. Then these names must be now drumming in your mind, right? Lateral head of triceps and long head of triceps. Very quickly, someone said biceps, right? I know that it was just slip of mine, but yes, I could understand. And this is the lats or the latissimus dorsi. So that is also known to you. This is the tendinous part of triceps, just the figure. Tendinous part, right? It is the tendinous part of triceps. So when we say ligament, so it is bone to bone, right? Ligament is bone to bone, and the tendon is muscle to bone. So muscle to bone, that is what gives power, right? Tendons, they give power, and the ligaments, they give stability, right? They give stability. Now from here on, what is the entire journey would be, we'll be removing layer by layer, one by one. We'll keep on removing the muscles and we'll go all the way from the superficial layer to the deepest layer and we'll reach to the bones. This is the process which you have to keep on repeating, right? You have to keep on repeating it 3, 4, 5 times unless the whole thing is cemented into your brain. You understand, even if you close your eyes, you know that where is rhomboides, where is splenius capitis, where, right? That entire thing should be crystal clear in your mind. That's why pay attention that are removed and these are the muscles which we get. Now we are removing as we remove the traps. Obviously, this is supraspinatus, infraspinatus, teres minor, teres major, and latissimus dorsi. No need to even talk about it. You know it thoroughly. But we see these two muscles, right? When we remove the deltoid and when we remove this trapezius, now what we are watching is, see, wonderful. That is what is called as the rhomboidus major, big muscle, this one, and above a strip-like muscle, very small strip, that is the rhomboidus minor. Here it is, right? Their shape is rhomboidus, right? So these are the muscles. So here, what we need to understand is that exactly what it is. This is the medial border, or it is the medial border of scapula. Correct. It is the medial border of scapula. On medial border of scapula, the muscles which are going on the lateral side, the muscles which are coming on the medial side, muscles which are going on the lateral side, that was the supraspinatus, infraspinatus, right? Over there, we saw the teres major, teres minor, right? All those muscles are there. But the muscles which are coming on inside, right, which are coming towards the center, that is the rhomboidus major and the rhomboidus minor. No doubt there is one more muscle which is over here, but we'll talk about it in a bit, right? So that is how. So now we know that what is the importance of scapula. This scapula, which we initially considered, just we felt the spine, hoga ek chota sa bone. Now see, so many muscles, they are associated with it, right? Till this point, we have already talked about so many of them. Right? We have talked about the biceps. We have talked about the subscapularis. We have talked about supraspinatus, infraspinatus. Right? We talked about teres major, teres minor. Now we are talking about rhomboidus minor, then below the rhomboidus major. So that's how this flat bone, which is giving stability to the back in the upper aspect. With respect to the shoulder, because it will be taking part of the shoulder movement. On to the next one. Traps and delts,
Sir, I had a doubt.
बोलो.
If you said that serratus anterior when is damaged, the scapula starts winging, right? Sir, then the rhomboidus major and minor can't keep it close to the backside because they are pulling in the same direction.
No, it will be, we'll come to that. We'll come to that. What it really does is, right? Because see, they are the
Okay.
posterior muscles. So when, imagine what will they do? These are the scapula. When rhomboidus major and minor, right, they will contract, they will do like this. So it is like when when you try to take the scapula back, right? Retract, you try to take them near. So when you pull your shoulders near, right, those scapulas, they will be coming near to each other. That is what they do. They'll be working in the horizontal plane. But when you try to push anything, so these rhomboidus major minor, they have got no role, right? They have got no role. In fact, they relax, right? So over here, the
If
function
they
of
contract it, the winging will be even more, right?
yes,
Okay,
exactly.
okay,
Exactly,
okay,
right?
okay.
So that's why when we push, right, and we do like this, then winging will be, sorry. Oh, I said sorry to Mike, right? But that winging will be prominent, right? So winging is like when the scapula is leading the body and as if it is coming out. Okay, right? So this is rhomboidus major and rhomboidus minor, and this top muscle, which I was talking about, that is the levator scapulae. Name tells levator scapula. So it will lift the scapula. So when you shrug your shoulders, right? So actually, when the scapula is lifted, right? So that is the levator scapula. It's not only levator scapula is operation, even other muscles are involved, which will be watching. But yes, levator scapula, it is one. So when it is one shoulder, second shoulder, so either one muscle is contracting or both muscles are contracting, depending upon symmetric or the asymmetric movements which will be occurring. Right. So these are the three star muscles which we talked about them today. Moving further. Still, right? We are adding one more muscle. So this, we are adding this time splenius capitis. Remember, when we say capitis, there will be only two words which will be revolving around, right? They'll be coming again. One which is called as capitis. When it is capitis, that means capital. Capital is head. So that means when we are dealing with head, when the word will coli come, right? Coli, it will come, right? When coli will come, that means we are talking about the sides. We are talking about the neck, right? So if we are talking about splenius capitis, that means we are talking about the head part. When we are talking about coli, so coli means things will be more related to the neck, right? Things will be more related to neck. All right. So this is the new muscle which we are introducing, splenius capitis. Think it like it is starting from spine, so that's why splenius, and it is going towards the head, right? It is going towards the head, right? Connected to head.
Its
That's
function is?
it will come, it will come. So, so that was the splenius capitis. So now what we did is we removed the rhomboidus major and rhomboidus minor, right? Rhomboidus major was here, right? Be very clear. We are removing this muscle, right? When we remove, similar type of muscles are appearing over here, right? And not only that, we removed even this latissimus dorsi, right? So we are removing, and we are removing rhomboidus major and rhomboidus minor. So it is like we are opening the entire back, right? Here it is, right? See that lattice is removed, and over here, right? Those rhomboidus major and minor, they are removed. We are coming across those serrated muscles. So that serratus anterior, which was over there, now we are watching exactly similar type. So that is called as the serratus posterior. But say similar set is even below also. So now we change the name. Serratus posterior superior, serratus posterior inferior. So thus there was one group of muscle with serratus anterior, but in case of posterior, we have got the serratus posterior superior and the serratus posterior inferior. Again, they are going over there, right? So we have got now the levator scapulae. We have got serratus posterior superior and serratus posterior inferior. Rest of the muscles, supraspinatus, infraspinatus, teres minor and teres major. And this is the lateral head. This is the long head of triceps, right? 3 is triceps. So we are not writing, we know it is, that was the sort of revision, right? And the splenius capitis, now it is getting exposed slowly and gradually, right? Over here, we thought that होगा एक छोटा सा muscle, right? Over here, we saw it, that it's small muscle. But as we are removing other muscles, we find that it is not that small, right? It is a pretty big muscle. So that is the splenius capitis, but we have already discussed it. Levator scapulae, we move further. What we have done is, we removed all serrats, right? So serratus, posterior, superior, and inferior. Both of them have been eliminated. And we find that it was not only the splenius capitis. Splenius capitis we have discussed. Above splenius capitis, there is a very small muscle, right? It is very small muscle. So splenius capitis, again, its name is splenius capitis, but because it is half of that, so that's why we use semispinalis capitis. Semispinalis capitis. So we have now semispinalis capitis. Then this is the coli which we talked about. Coli means it is associated with neck, because that's why its other name is. It is also known as cervicis, right? So this is, we have got 3 muscles, a short muscle which is semispinalis capitis, 1. There is splenius capitis, 2. And then there is splenius coli. So take it this way, that these 2 are big. So whenever the splenius capitis is contracting, right, it will be the move of the entire head, right? But splenius coli, right, that will be used for the rotation, right, when the neck is involved. So capitis, for any of the movement, it is not only that one muscle would work, even other muscles will also be taking part in it. But who will be taking bigger role? That's what it defined. So that's why.
There would be accessory like
Yes.
accessory muscles.
For finer adjustments, right? Those small muscles, they are for the finer adjustments. I mean, if there is someone beautiful, so how much neck is to be rotated, right? Don't use the splenius capitis. Pura sar utha ke aise ghuma diya. Good adjustments. So capitis, so that is head focused. Coli is neck focused. Right? Iski importance will be in physiotherapy. You know, the new rule came up just day before yesterday. Yesterday, the new rule from the Medical Council of India, that now onwards, those physiotherapists, they won't be able to write DR, doctor. Right? It is absolutely misleading. So they said that if they write, there would be the legal action. I know there are some physiotherapy center and they say it so confidently, "Kara, hum bhi doctor hi hain." And actually, you will find that they just know some of the exercises, but not really. And they were making that person run who was the cardiac patient. It happened just before few months. Patient died. So, right, remember this. It was a very sad event, because the person who died was father of my batchmate. But they said case karo, ye karo, but what's the point? Person will be coming back. And so, so capitis is head focused, coli is neck focused.
Sir,
Someone asked me.
sir, in the first, like in the previous image, the first thing was spinalis, and the second one we were adding splenius.
Ah,
Like, does that have any significance why we are adding the spinalis and splenius?
okay. Spinalis is the major connections which are over here, right? They are absolutely in the center. When we'll be going in more depth, we'll see that's it. This is the vertebra. These are the transverse processes. And this is the spine. If the muscle is connected only on spine, so that is what is called as the spinalis. So from spine to head. So that is spinalis capitis. For splenius capitis, it is this portion as well as this portion. Even on the body also it is attached, right? But again, it is going towards the head. So that would be the difference. Right? Good question.
Okay, sir.
So we remove few more muscles and we are going into depth. Now this is very vital. Maximum confusion it is into this image. Watch it like this. First thing first, things which we know. We know splenius capitis, a B pathway. So this part we know. And just underneath there is splenius coli. Now when we remove those muscles, we find that splenius coli is also pretty big muscle. And then there was one muscle which was above splenius capitis, and that was
Finalis.
Spinalis capitis.
very nice. That was semispinalis capitis. So you know semispinalis capitis, you know splenius capitis, and you know splenius coli, right? These three are known to you. In the same order, now we are going back. Now you'll find that all these muscles, they are associated as if they are all straps, right? They are the straps. When these muscles, they contract, right? They will keep your back straight. Now, one interesting thing which I tell you, I mean, sometimes I got the email also कि आप तो कुछ भी बोलते हैं, but हाँ, that is a reality, yeah. That is a reality, right? Say in the brain of the males, right? So there's S raised to X, right? So that is always in the mind of a male. For a female, it is the care, right? Because that is dependent on testosterone and the estrogen progesterone. That is how, and if you read that men are from Mars, women are from Venus, you'll understand it clearly. But this is like when you watch any of the person, what do they watch? They say that how good is her figure, correct? In case of males, the back is playing a vital role because back, if it is strong, so it will give you that curve. It will give you that curve. So chest exercise, people do. Back exercise, very rarely. Even in gym, right? People will be doing that heavy chest exercise. But if the back is good, it will give you that stability, right? And the thing which is called as the perfect figure in case of males, right? Back plays a major role. It plays a major role. And that's why if you see Bruce Lee's movie, right? So in the initial warm-ups, right, they show that their back is so powerful because these muscles, you'll see that how powerful these muscles are when you punch, right? When you punch. So these are the muscles. And then I'll show you some of the exercise. You do it just for 3 minutes a day. Again, None of these exercises, they are to be done more, but 1 minute exercise, 3 rounds. What should be the, and you asked in the mail that what should be the rest period? Rest period is you become comfortable but not totally relaxed. That should be the correct rest time. You should not be.
Till heart rates come at okayish level.
हार्ट रेट तो दोस्त इसके अंदर ज्यादा नहीं बढ़ते because see, if even if you are taking the reverse dumbbell and then you are stretching it, that is when you are retracting it, right? So your back will be crying, but your heart rate won't increase much because at the most kya, as per the Arnold, right? First set you go for 16, second set you go for 14, the third set you go for 12 or 10, and there comes the killer set. This is the fourth set. Fourth set kitna?
Drop
Till you
set like.
fail, till you fail. Keep on doing it because by this time you're tired, right? So those extra fibers, whatever which are left out, you start utilizing them. The last rap should be that if someone tells you कि चल boss तुझे 2 crore दिए, नहीं तो भी एक भी नहीं होगा. That means you have exhausted all of your ATP. But that is the thing. That is after that when you feel like कि हाँ कुछ हुआ, right? You feel that particular muscle. These are the muscles which we are talking about. Okay. So these are 4 major muscles. These are the 4 major muscles which will be keeping your back, and you will never suffer from any of the back pain if these muscles are good. We started, and see all of them, they are like steps, right? Long steps. The first one which we are picking up is number 3. Number 3. All the way from the splenius coli, right? It is at that high level and it is coming all the way down. It is coming till iliac crest, right? Long muscle, that's why it is called as the longissimus. And it is covering the entire thorax, so that's why thoracis. So this is the longissimus thoracis. Longissimus thoracis, so now you know that this is for the entire thorax, right? Entire thorax, right? It is that long muscle. Now, go slightly inside. Without my telling, you will know that this is called as spinalis thoracis, right? Spinalis thoracis. Because from where is it emerging? It is emerging from the spine,
Spine.
right? So spinalis thoracis. So that is spinalis thoracis and the longissimus thoracis. They are now giving that support, this support. Let's move slightly outside. Right? Now we are talking about this muscle. Now muscle number 2. Iliocostalis thoracis. नाम आ गया ना, so iliocostalis thoracis. So this will be slightly lateral muscle, right? This is slightly lateral muscle going into thorax, but this will be landing on the iliac crest, right? So this is iliocostalis thoracis. And similarly, the last muscle which is absolutely outside, which is only into lumbar region. Loin means waist. Loin means waist, right? So it is just outside. So it is called as the iliocostalis lumborum for the lumbar region. So we have got now from the outer side, we have got the iliocostalis lumborum. Then comes the iliocostalis thoracis. Then comes the long muscle longissimus thoracis, and someone which is absolutely in the center. It is called as the spinalis thoracis, right? And then, like a belt, this is our transversus abdominis, right? Which is like a transverse muscle. Then on the anterior side, there is external oblique, internal oblique, right? They are the muscles. But this is like a belt, right? This is like a belt from the posterior aspect, and that is the transversus abdominis. It is not necessary.
Sir,
Huh.
could you explain the iliocostalis thing again?
Sure. Means that very rarely these muscles will be coming in viva. Very rarely, right? But do remember it. You talked about iliocostalis. Iliocostalis is, see, it is the lateral most muscle. It is the lateral most of this entire group. So this will be landing on the iliac crest over here. It will be landing on the iliac crest. But as such, right, it is which is the muscle which is taking care of the lumbar region. right? Lumbar region. So that is after thoracic, after thorax, there is a lumbar region. So that's why this is lateral. It is not going all the way up to this much level, right? If it is going that high, so it is okay. It makes sense that we call this muscle as the thoracic. But no, this is pretty on the side, and its main function is that it is giving shape to the waist, right? It is going on to the lumbar region. So that's why it is called as the iliocostalis lumborum from the sides. Now see, we remove more, right? That semispinalis capitis. So what we have done is we have removed splenius capitis, correct? We removed the splenius capitis. And when we remove the splenius capitis, two muscles, which one, we find this semispinalis capitis, which we were telling कि हाँ छोटा सा muscle. No, it is not that chota, right? It was looking small, but as such it is so big, right? Such a big muscle. So this is semispinalis capitis. That is one. And this one, longissimus capitis, it is really long in every aspect. Longissimus capitis, right? So that is the longissimus capitis. So here is the semispinalis coli, right? That small muscle which was related to the neck. What you really need to watch is this muscle. This is pretty
No, sir,
important.
that was spinalis, splenius coli, which we talked about.
Which one?
Semispinalis coli we didn't talk about.
This one you are talking, this one?
Yes, sir.
Ah,
Sir, we talked about splenius coli, right?
ah. अच्छा, हाँ sorry. हाँ बोलो.
Sir, the splenius coli and semispinalis coli are different, no?
हाँ, they are different. They are different.
Okay.
Say, because these are now deep muscles, no? We have removed all those superficial muscles which we learned, right? This is the
Okay.
last small muscle, deepest small muscle, that is the semispinalis coli. Splenius coli we have removed. That we removed way back, right? This splenius coli, which is quite superficial, we removed that. Splenius capitis. So now we are watching over here is semispinalis capitis. Splenius capitis removed, splenius coli removed, right? And related to that, now we are watching the
Semispinalis capitis is also removed. Okay.
right? So over here, this continuous muscle, this is multifidus, right? That multifidus, this one, this one, this one, this one, this one. That is the multifidus. And this quadratus lumborum from its shape, right? This is the quad shape. So that is the quadratus lumborum. So over here, the transverse abdominis, right? That we have removed. And we remove them also. So finally, what is coming up is this, that see longissimus coli, right? The deepest muscle. And then all these small muscles, right? These are the spinal rotators. So there is a long rotator and there is a short rotator. Long rotator, there is a short rotator. Just a minute, huh? They disconnected the cable. They switched off the main supply. जैसे वो केबल बीच में आ रहा था तो हमने निकाल दिया. ऐसे अच्छा है अब डॉक्टर ने, नहीं तो कहेंगे वो आर्टरी बीच में आ रही थी तो हमने निकाल दी. So here it is. This is where we were. Right here, this is trapezius. And we talked about that there are three types of fibers: the descending fiber, the transverse fiber, and the ascending fibers. As we are looking from the back, right? So we are watching this platysma, partial platysma, which is onto the anterior aspect of the neck, right? And here it is. We know now these three muscles. This is one, that is the levator scapulae. The second one, that is the rhomboides minor, and this niche, that is the rhomboides major. We know these three muscles. Obviously, we know this deltoid, supraspinatus, infraspinatus, teres major, lateral, and the long head of triceps, and the latissimus dorsi, and the trapezius, right? We know those muscles. This is a spatial muscle. That's why we are taking it. This is what is called as the omohyoid. Omohyoid speciality is that it has got two bellies. Two belly. So belly is a flashy part. So this is the superior belly, and then there is an inferior belly. It is connected to this hyoid bone, right? At the top, hyoid bone. So from hyoid bone, it comes down, and then there is a tendon which is in between. Normally, it happens like tendon is at the end. But because it has got the dual belly, that's why this is a tendon. There are very few muscles in the entire body where this situation will be occurring. But such muscles, they are extremely efficient in changing the direction of the pull. Right? So this tendon, which will be acting like a pivot, and then it will be moving. Its function, what it really does, that would actually come in the head and neck. But the point is that it has got two bellies, superior belly and the inferior belly. Okay. Platysma, known to you. This is levator scapulae, rhomboides minor, rhomboides major, and this is serratus posterior superior. Correct? A small portion. It was the good doctor should be to you the always clear. नहीं देखा. Serratus posterior superior. Now here it is. We are now on to the anterior aspect. We are on to the anterior aspect because immediately you will find that this is the manubrium. Right? Here is the manubrium. Right? So we can say that this is the anterior aspect. And in anterior aspect, we are watching, that's the first rib. Right? First rib. And this is the portion which we call as the subclavian artery. Right? Left subclavian artery, which is emerging directly from the arch of aorta. right? So that is the left subclavian artery. In left subclavian artery, we need to see its branches. So there is one, what is called as the thyrocervical trunk, right? So that's the thyrocervical trunk from which the one artery which is coming and it is worth talking about it is suprascapular artery. Suprascapular is what? Suprascapular is this is the area of scapula just above the scapula it is coming. So this is what is called as the suprascapular artery, right? So let's see this left subclavian bit properly. So first one, it's a left subclavian artery, right? This is a thyrocervical trunk, and we talked about suprascapular. As such, the branches, one is the superior thoracic artery, second is this thyrocervical trunk. So here it is, right? Here everything I will have. So this part was not discussed in that YouTube. So the first branch, we are just dealing with the branches of subclavian artery, right? From the first rib edge, it will become axillary artery. And in axillary artery, we have seen that it has got three parts. That pectoralis minor was there. So first part before that, two arteries underneath and three after that, right? That was the axillary. We are talking about something which is before that. So subclavian. So we have got subclavian, and in that subclavian, one is superior thoracic artery. And second, we have got the trunk, that is thoracoacromial trunk. It is the thyro, right? So I think here we have to change it. Just a minute. Here it is thyro. Right? So it has got the. Wait.
Sir,
Yeah.
this is thoraco.
नहीं गलती कर दी I made the mistake. Auxiliary part we have already discussed. अच्छा, चलो. Let's take it simple. Let's make it simple. Subclavian artery, and that's the axillary artery. Okay. This, and that is the pectoralis minor. We have got one branch here. We have got two branches here, and we have got three branches here. Okay. And over here, there is thyroacromial duct or trunk, right? Thyroacromial trunk, right? Which is over here. For these three branches, right? These are the three branches which we already talked about, right? So this is the axillary, superior thoracic, thoracoacromial, that is ABCD. And the third part is subscapular and the anterior and posterior circumflex humeral, right? Which we have already talked about. So here it is the suprascapular. This is the suprascapular artery, which is coming up from subclavian artery. Now it is okay. Now see, the suprascapular vein is also accompanying it. So these are the areas where there will be, say, vein is accompanied by the artery. And then we have anterior circumflex humeral artery, posterior circumflex humeral artery, and that is these are the circumflex. Circumflex is what is winding around, which is winding around. Oh. Now for the concept, because we are about to see all those nerves, right? The nerves which we didn't discuss during our brachial plexus, right? So in brachial plexus, this much was discussed, that there is a lateral cord, there is a medial cord, and then there is the posterior cord. Posterior cord, which is made by the posterior divisions of all three. Medial cord, which was coming straight, and lateral was the combination of top two. Right? So lateral cord, and we remember par is posterior cord, and it is giving axillary and the radial. So done. Medial cord will not be giving musculocutaneous, so that is done. And the lateral cord, that will be taking part for the formation of the median nerve. A major part is coming from this, a small root which will be coming from the medial root also in the form of from the medial cord. And thus we have got the median nerve. And this last left out portion is ulnar nerve. This much we have talked about. Median and the median nerve. So this was like root trunk division cord. So now we are on to the superior trunk. Right? Superior trunk. So they right in the beginning, this is the root. From root, we are forming the trunk, and in that there is superior trunk, and these are the nerves which are coming from the superior trunk. That is the nerve to subclavius. Right? Nerve to subclavius and the suprascapular nerve. We talked about these two nerves at that time, but just in a brief. Right? But again, it is the short because we'll be watching it. From the posterior cord, there goes one nerve, which is nerve to latissimus dorsi, nerve to lats, and subscapular, that is upper and lower subscapular. So three nerves will be coming from posterior cord. See, till this point, we were talking about the ends, right? We were following this, that root, trunk, division, and cord, and then the branches. But now what we are talking about is from the some branches which are coming from the cord, some branches which are coming from the trunk, right? That's what we are talking. Some branches which will be coming directly from the root, right? Or that serratus. So that's what. Divisions, kuch division to this straight away just divided into anterior posterior. So here it is, from the posterior cord, we are having this nerve to latissimus dorsi and this subscapular, upper and lower. So this is subscapular, right? When we talk about, say, suprascapular is from upper trunk, right? Suprascapular is from upper trunk, right? Upper trunk, that is that quite early, while subscapular, it is from cord, right? So supra was emerging quite high, sub, they are emerging at the cord, right? It makes sense also because suprascapular, that is released quite early from the trunk only. All right. Moving further. So that's suprascapular, right? Which is from the superior trunk. And that superior trunk is also giving one branch to nerve to subclavius. Both important and quite early because say, otherwise the cords, they will be coming down and then going all the way back to supply, that becomes too far. So that's so by the time when the trunk was coming, trunk said, okay, you take the nerves, right? Because they are supra. Now, you must be knowing that there are 12 cranial nerves, right? There are 12
Yes.
cranial nerves. So they are olfactory, then optic, and oculomotor, trochlear, then trigeminal, abductions, then seventh nerve palsy, which is very common, that is the facial nerve, right? Facial. Then eighth is for ear, vestibulocochlear, vestibular part, which is for hearing and the balance. Cochlea, which is for the balance. 9th, 10th, 11th, and 12th. Why we are discussing all these? This is because this is vagus, this is hypoglossal, this is glossopharyngeal, but what we are over here, this is spinal accessory. This is the nerve. 11th nerve. Right. This is the 11th cranial nerve. Right. This is the spinal accessory nerve, which is emerging from here. So that's why this is emerging straight away from C to C3. C to C3. All these nerves, say olfactory, which is sensory, right, which is for smell, optic, which is for vision. Then 3, 4, and 6, they are motor, right? It's because they will be handling the eyeball, right? Trigeminal is like both. It is mixed. It is motor as well as sensory. You know the mnemonics. What's the message? Just we massage back near spine with finger. It's a group of muscles. That's right. It's a group of muscles. Omohyoid is, that's right. Omohyoid is anterior. Yes, that is the cervical tract. True. Acha, regarding this, there is a very interesting mnemonic, right? It is like, say, some say marry money, right? So here, this is sensory, this is S is for sensory and M is for motor. S is for sensory and M is for motor, right? But my brother, so here it is P, M, this is also B, then this is vestibulocochlear, right? So the vestibulocochlear, that my brother
Sensory.
says, right? So this is sensory. Then once again, it is all mixed and motor. 1, 2, 3. Big brain matters most. So this is again glossopharyngeal, which is for the tongue and the sensation. Vagus, so obviously it is both, right? Then this spinal accessory, which is supplying the muscles of the back, and hypoglossal, once again, it is which is just controlling the tongue, right? So that is how all these nerves, they are involved, right? Whether sensory or motor or both. This we just as such, but this is like a very common question, and it definitely comes in Viva, especially when we are talking about head and neck and brain. So this question surely comes. कहीं ना कहीं तो पूछ ही लेते हैं.
बोले 100 डॉलर का तो फिर बोले कॉन्वर्सेशन लगा कोई तरह फिर बोले कि स्टेशन पे ऐसा मतलब हाँ फिर बोले ठीक है कोई
Right, so this is the spinal accessory. This is the 11th nerve. The 11th nerve. Take it. 11th cranial nerve. There is a plexus which is called as the subtrapezoid plexus. Name itself suggests subtrapezoid, under the trapezoid. Okay. So here are that's the accessory nerve which we are watching, that pinkish thing, right? That is, and all the cervical segments which are coming out. One day we'll be discussing, say, this. So how this posterior rami, that's the anterior rami. In general, say this is what is called as the posterior rami. Rami means branch, and this is what is called as the anterior rami. Right? Signals are always received on the posterior aspect. So they are incoming. Motors, that is the brain, tells ke go and contract that muscle. So that is the motor. So motor fibers, they are always from the anterior aspect. And the sensory part, they are from the posterior aspect. And then this is what is called as the anterior horn also, anterior horn. And then there is a posterior horn, and then there is a lateral horn. Lateral horn is for our sympathetic and parasympathetics, right? Autonomic nervous system. So we'll see this thing, that how they come out, how is that ganglia which is formed, what is the relay center, and then how they divide, and how one particular nerve which is going, and in that it is associated with parasympathetic fibers, which was the basis of Horner syndrome, right? Horner syndrome. Horner syndrome, in which we ptosis, meiosis, and ophthalmos, right? Loss of ciliospinal reflex, all those things, they were occurring because when the nerve is injured, because that nerve was also carrying parasympathetic fibers, right? So that's the reason, sympathetic fibers. So that's why when those fibers, they were damaged, it led to some extra condition also. That is, the brachial plexus was damaged. But along with that, some of the autonomic nervous system symptoms, they also occurred because those fibers, they were damaged. Right? This is in nutshell, but when we'll be discussing that, okay, this is the central canal, and then how is the gray matter and the white matter, and how they are distributed, how the tracks are formed, right? This will take in advance before we'll start even the head and neck. Just within next 10 days only, right? We'll take this entire topic. Though it has got not much to do with the upper limb, but just for the concept. We'll take that. Right, so this is posterior rami. The moment it is said posterior rami, that means posterior rami will be carrying what? They will be carrying sensations, right? Because they are sensory. They will be sending it to spinal cord, and they are sending it to spinal cord. So from where? Where are the organs? There are no organs over here. We are dealing with the upper limb. So skin, touch sensation, thermal sensations, they will be pain sensations. They will be all carried by the posterior rami, right? So these posterior rami, they will be going for what is called as the cutaneous innervation, cutaneous, under the skin, right? So all those sensations, they are carried out. All the way from T1 to T12 and C2 to C6, cervical and thoracic portion, that is all is carried by these posterior rami. This is our brachial plexus. In our brachial plexus, we have got lateral, posterior, and the medial cords, right? If we really want to figure out how they are formed, yes, it is easy. Lateral is formed by two, right? You can watch this, that yes, it is formed by the one and the two, and it is formed, right? In case of medial to going straight away it is going. And the posterior, that is behind by all the three posterior divisions. The medial and the lateral, they meet. They form this
Median.
median nerve, exactly. That is the median nerve. So if that is the median nerve, this nerve, right? This is the nerve which is emerging. That will be the musculocutaneous, right? So that part is done. Over here, we want to see that from the posterior cord, this is the lateral nerve to latissimus dorsi. That's the nerve. Right? That's the nerve which is emerging, which is from the posterior cord.
Sir,
Huh?
Then the upper and lower subscapular nerve.
Hmm.
They will also be near, right?
They will be also. Yes. Just they are coming up. Here it is. One very vital concept. Very vital. We just finished this concept. We talked about that there is lateral pectoral and the medial pectoral now. They were supplying which muscle? Pectoralis major, correct? So they were supplying the pectoralis major, and we said that there is a lateral pectoral nerve and then there is a medial pectoral nerve. And from where do they emerge? And we said that is very simple. Lateral pectoral is emerging from the lateral cord and the medial pectoral is emerging from the medial cord. That is how it is happening. But see, the point is, this side is medial side, correct? And this is the lateral side, agreed? Because see, this is the coracoid process and that's the end of the clavicle. The medial pectoral nerve, this medial pectoral nerve, it is over here, this portion. This is the medial pectoral nerve, this. And the lateral pectoral nerve, it is emerging from the lateral cord and it is over here. So that's the lateral. I just removed. The point is to understand is this. That lateral cord, it gives to lateral pectoral nerve, but it is on the medial side. Medial cord moves further and then it gives a branch, and that branch, which is called as the medial pectoral nerve, right? But it supplies the lateral side. So remember that names are given as per their cord emergence and not their physical emergence. So when you come across these nerves, this is like a googly question. That lateral cord, because when it is asked, okay, lateral pectoral nerve emerges from lateral cord. Which part of the pectoralis major it supplies? And blindly we say lateral part, correct? Because logically it is like that. But this, never forget, right? Never forget. If this question comes, remember that you have done excellent and now examiner wants to trap you. So this is how it goes, right? Very important. Never forget. This can give you such a big credit in case if you reach to this point. Is this part clear?
Yes.
Yes, sir.
Yes, sir.
Oh,
Sir, can you repeat once more?
sure. This is medial cord. This is lateral cord, correct? So here is our central line. So brachial plexus is emerging, right? That's the lateral side. That's the lateral side. When the branches, when the nerves emerge, this is the lateral pectoral nerve. When it comes to medial goes like this. So this is medial pectoral nerve. Now tell me, this is the area of the chest. We divide it into two parts. So this part would be called as medial or lateral? This part?
Medial.
Medial.
Correct. This is medial part, medial side, and this one is the lateral aspect. Lateral.
Yes.
But see who is supplying.
It's the opposite.
It's the opposite because medial pectoral nerve emerges later. So that's why medial pectoral nerve is situated on the lateral aspect. Medial pectoral nerve is on the lateral aspect. I'm sorry, lateral pectoral nerve is on the medial aspect, right? So that's how they supply. That's how they supply. The names, they are as per emergence, right? Remember, names as per emergence. From where are they emerging? That is what is giving the name. Okay. Now we know that levator scapulae, then rhomboidus minor, rhomboides major, they all were in one line. All of them, they are supplied by this one common nerve, which is emerging straight away from the root, right? Straight away from the root, C5, C6. So this emerges from C5, straight away from C5 root, a single nerve goes, and that is the dorsal scapular, which is from C5, and it supplies these three muscles. Levator scapulae, rhomboides minor, and the rhomboides major, all the way. That is what is called as the dorsal scapular. These are very special nerves, because it has got very specific fixed function. So that's the dorsal scapular. See, it is emerging from C5, and then dedicatedly it is going all the way, and it ends here. So it will be supplying all those muscles which are connected, right? Levator scapulae, rhomboides minor, and major. They are supplied. We now move on to this one specific area, which is called as the triangle of auscultation. Triangle of auscultation, because this is the small window where there are very less muscles. So that's why if you put the stethoscope, you'll be able to hear very nicely, right? Especially the respiratory sound, because it is present on both the sides. So even on right side, when you auscultate, right, you won't be able to hear properly the heart sounds, but the respiratory sounds, they'll be heard very clearly. So this is the trapezius, that's the deltoid, and this is the latissimus dorsi. So this is how the boundary is formed. So this is also called as the triangle of auscultation. So you put the stethoscope and you listen to that area, and you'll be able to hear respiratory sounds best. Now, we extend this so that there is no confusion. So this latissimus dorsi, it will come down, right? Latissimus dorsi. And as you go down, this is the area. The latissimus dorsi will come down and then it will be inserted. This is external oblique on one side, right? And this is our iliac crest. If this external oblique is not fully covering, or it is not going behind latissimus dorsi, the second window is there. The second window, this one. And that is lumbar triangle of Pettit. There is no other function, but this is for a potential lumbar hernia. Contents of the abdomen, they can come out via this part. So this is the what is called as lumbar triangle of Pettit.
Sir, is it rare?
See. Right? That's the trapezius. So it is here. And when we talked about this auscultation, so it is, see, this is the level of shoulder. Right? This is the level of shoulder, right? And this is almost just above this is iliac crest. So you know, when you put your hands just where your thumb is, your thumb is usually on this lumbar triangle of Pettit.
Okay, sir.
So that's our trapezius external protuberance. Now we are talking about all the actions. The insertion, that is lateral 1/3 of clavicle, and the spine and the apex of triangle, this entire area, right? So thus this is a big muscle connected at one place, a small place, and then over here it is fanned. From front, this is how they look like. So you will appreciate this part, that this portion, and it is connected to neck. So if you, two things are possible now. Head steady, and then it is shrugging the shoulders, it can be used. And what if I steady the shoulder and this muscle contracts, so then the neck would be flexed, correct? So
Yes.
this is how Both the things can occur. When the muscle is connected at two places, which area is fixed and which one is moving, accordingly the action is taken. See this, right? This is just transparent muscle has been made. Bit transparent so that we can see that how extensively it is connected. Now comes for the trapezius, these are the upper fibers. So these upper fibers, they are connected and their function is one, when the neck is flexed, so those upper fibers will contract and will make the neck straight. This is called as the extension, right? It is called as the neck extension. So about 65 degrees is the neck extension. So by the end of this extension, the head would be coming into normal position. So this is extension. But at the same time, if it contracts more, so it can take the head back also, right? Head back. So that's why it is called as hyperextension, right? If it is continued more, so it is called as hyperextension. When it is hyperextension, this number varies. Normally, it is said that you can do it by 40%, but this is maximum, right? How much neck can be taken back? So that is also done by this. Upper trapezius fiber, right? The trapezius, which is like this, right? They are connected. So these muscles, they'll be taking part for this action. Upper fibers.
Sir,
Hmm.
does it depend on flexibility also, or is it natural?
Surely.
Okay.
It will make some difference. If your body is flexible, so yes, you might be able to flex for about, say, 4 or 5 degrees more. So the numbers which are over here, say 40 degree, so many people, they won't be able to cross even 20 degree. If they are having cervical pain or stiff neck. So all those things, they'll reduce it.
Yes, sir.
Acha. Upper fibers, one more thing, what is called as the scapular adduction. Scapular adduction. So if the scapula, right, it will try to pull the scapula and it will try to keep it near the body. But main function, that is by serratus, because there are so many serrations, so many insertions, and they are holding it. But this also takes part. Then shoulder retraction. So when the hand is like this and when you try to take your hand back, yes, they will be contracting from the top. So that is, these are the two major functions, two functions. One, the shoulder retraction, right? It contracts and it pulls, right? And the scapular adduction. The scapula is far, it is coming near. All because of trapezius. Then these upper fibers, only on one side of the fiber, and when this area is fixed. So when this muscles contract, so yes, it will be tilting head on left side or right side. This area is fixed. And when they pull, so obviously it will take the shoulder up. Right? The shoulder up. When it contracts, the shoulder up. That is what is called a shoulder elevation. So this was the descending part or the superior part. This is the ascending part or the inferior part. And then there is a transverse part. Now for the ascending part, if this is taking this muscle, same muscle, right? The upper fibers, they were taking the shoulder up. Then lower fibers, they will pull, and they are called as the shoulder depression. So one muscle only, but its ascending part is going for depression, and the descending part is going for this elevation of the shoulder.
Sir,
Huh?
the previous function, like the one before this one, this can be for levator scapulae.
Huh?
Can
No,
this be for that?
levator scapula will also be taken, because see, as we said, that one one function, it is carried by multiple muscles. Right?
Yes.
So
So
levator scapula.
even the lateral flexion or
Yes.
what?
Levator scapula, what it will do is
Stabilize the movement, right? The
it will
scapula.
elevate and fix the scapula. That is the levator scapulae. And this shoulder elevation, rest of the movements, right? So when the shoulders only are to be taken up, but the scapula, when you take the scapula also, so there is one when you just shrug the shoulder, or when you take the shoulder and try to touch your ear. When you try to touch your ear, this is the point when the scapula is up. But if you just do like this, right? This part, right? That part is in scapula is like there only. So that is the difference between shoulder elevation and the scapular elevation. Classically, when you try to touch your shoulder to your ears, right? When you are doing this, now you check your scapula, right? It will be much proper. So in such those excessive movements, they are used.
So
When
if
you
this,
when you take deep breathe, forced breathing, right? Scapula is involved. That is when the levator will come into picture. Yes, yes, you are
so
asking
if
something.
the scapula is fixed, then lateral flexion kind of. Yeah.
Little. That's it. Shoulder retraction. Right. Now that is the function of this latissimus dorsi. ठीक है ना? Because latissimus dorsi is where into that groove in between it is there. So the hand is like that. When it contracts straight up, it will pull the whole assembly back. That is the shoulder retraction. Right? It will take the shoulder retraction because it is connected to the humerus. So it is pulling the humerus, rest of the hand will always follow. Now, that is when the hand is like this and it is retracting. But when the hand is normal and it is to be depressed, right? Shoulder depressed. So these are the fibers which will contract. So when they say drooping shoulders, so normal shoulders and then you droop it, right? So then when that for the drooping function, upper muscles relax and these muscles they contract and then they take it down. So this is like shoulder depression when arm is in normal position. So same selfie of that muscle, that is lats. Now when the whole muscle acts together, full muscle, it is connected on that humerus, onto that ridge. So when there is shoulder abduction, right, shoulder abduction, whole muscle pulls, the whole hand comes like this, whole hand. In gym, you must have seen that there are certain exercises when they do like this, right? Like this. So that muscle, right? It is not the chest exercise. So it is the exercise for this latissimus dorsi, right? Or there is one power crusher like of thing. It is with a strong spring, and on both the sides there are handles. And then when you try to crush. So when you try to crush, right, you just bend it like this. So there is a spring, and you try to bend it like this. So you'll find that it is giving exercise not on the muscles, but it is giving onto your back. It is the latissimus which is involved. Well, obviously, this is posterior. And it is leading to extension and hyperextension. So for the back. So if you have bent, right, you want to straighten yourself, this muscle will be helping. And at the same time, if you want to go for hyperextension, right, so when you lean back, so it is at that point, this will come into picture. Here, the whole muscle will work as one. That's the levator scapula. Side to side movement. So that is for lateral flexion, right? Side to side and slightly onto the anterior angle, anterior side. So this is lateral flexion because this lower portion is fixed and it contracts. So here it is. This is for the trapezius. When this part is fixed, this top portion is fixed. So then there would be shoulder elevation. Right? As such, upper fibers, they have to contract. So if this top portion is fixed, so it will lead to shoulder elevation. Rhomboidus minor, rhomboidus major. Just another view and see clearly. This is for the shoulder retraction, the question which you asked before. See, this is a big muscle connected to the entire border. So whenever there is winging of scapula, all these muscles, they will try to bring it back. So that's the shoulder retraction. So it's like this, and then you want to retract. You want to take the shoulder back, right? Even when you put it like this and then you just pull, you'll find that yes, it is happening in the lower back. It is happening into this back. The rhomboidus major, rhomboidus minor. Minor is also taking part into shoulder retraction because it is position is there. This was one of the questions which was asked that during explanation, they said that this particular muscle is coracobrachialis. So this is just for that clarification.
No.
Right? This is the short head of
Short
biceps.
head.
Right? This is the long head of biceps.
Yeah, under the
It's
short
short
head.
head.
Below
And
it is coracobrachialis, right?
yes, and
This very small muscle.
that strip which is just underneath it, right? So when we remove this, now it is still there, so now we have removed it, and then we see that okay, where is it running? Here it is. So that is the coracobrachialis. So that's it for today. All these muscles, right? This would be like a homework. All muscles. First, focus only on muscles. From superficial to deep. Try to visualize that, okay, one after the second layer, how are they removed, right? Removed and what muscle, what name comes. So for the name, in the second part, subclavian artery branches. And the third and last, draw full brachial plexus. Draw full brachial plexus. So when we say draw full brachial plexus, that is the indication of that you'll be writing about the nerves also. So that's it for today. So thank you so much.
Thank you, sir.
Thank you.
And
Thank you, sir.
thank you.
Thank you. Thank
We're
you
putting
so
it
much.
into our folder.